Well, good morning, everyone. I am Davina Fan. I am the NEHEP director here at NEI. I'm a Asian American woman wearing glasses, a black blazer, and a blue dress. And I am very thrilled to be here today to welcome you all to the NEHEP Partnership Summit of 2023. So to ensure that we're making today more accessible for attendees, we'd like to ask everyone to introduce your name and your organization before speaking and before making a comment or asking a question. And if you have any feedback on how we can improve this, we are really open to your suggestions. And so, and for the group's awareness, we're recording the 10 to 11 speaking as well as the 1 to 1:30. And so it will be available afterwards. And so we'll have timekeepers in the morning. We have Ashley here in the front, and we'll have Shiraz later in the afternoon to keep us on schedule for today. And so in the bathrooms, we have in the foyer, once you exit this room, there will be bathrooms to your left behind the elevators and across the foyer to your front. And so I wanted to share a little bit about NEI and as well as NEHEP and our planning group. And so the National Eye Institute supports cutting-edge research projects that investigate new ways to prevent, treat, or even reverse vision loss. NEI also helps the public learn about vision problems and how to get their eyes healthy. Our mission here at NEI is to eliminate vision loss and improve quality of life through vision research. And here at NEHEP, NEI created NEHEP to educate both professionals and the public about the importance of eye health. NEHEP works closely with health professionals and health educators to create resources and tools that we can use to raise awareness in our communities. NEHEP focuses on the importance of early detection and treatment of eye diseases, the benefits of vision rehabilitation, and populations at risk for eye diseases and vision loss. And so we have a group of planning group members that are experts in eye health, health education, health communication, and community outreach. Our NEHEP planning group members recommend NEHEP program priorities, advise on development, implementation, and evaluation of NEHEP activities. They also help review and refine NEHEP materials and resources. They also help us facilitate cooperation among the NEHEP partnership. And so we currently have 13 planning group members, 9 who are attending the summit today. So if you're a planning group member, please stand when I call your name and give a loud, warm hello so we know where you are in the room. So first we have Dr. Julia Rosedal. She's our NEHEP planning group chair and also helped with the planning for this event as a work group member. We have Dr. Royce Chen, who is on his way. We have Dr. Andrew Goyle, who is also the NEHEP Planning Group Summit group. And we're twinsies today. We're both wearing blue dresses. We have Dr. Janet Leisure in the back. Dr. Michael Maldonado sitting next to her. Dr. Edie Miller-Ellis. Dr. Miller is at the back table. And we have Dr. Susan Primo. And we have Dr. Penny Rosenblum, who is also part of our planning committee for this summit, and Dr. James Tsai. All right. And Dr. Wilkinson, Dr. Cheryl Reynolds, Dr. Judy Kim, and Dr. Zelia Correa aren't available today, but they send their regards and have helped with some of the planning of this as well. Also today we have Dr. Super Huang with us today. He is the past NEHEP Planning Group Chair. Dr. Huang, have you arrived? All right, well, we'll say hello to him when he comes in. So great. Now I'm going to share a little bit about this year's summit. So this year's summit title is Putting the I in Team, Uniting for a Shared Vision. Today we'll focus on the Healthy People 2030 Vision Objectives that we shared with you all last week, and how NEHEP partners can work together to make progress toward achieving the vision objectives. We'll also discuss diversity, equity, inclusion, and accessibility with a special focus on accessibility. On June 25th of 2021, President Biden signed an executive order titled Diversity, Equity, Inclusion, and Accessibility in the Federal Workplace. It defines the term accessibility as the design, construction, development, and maintenance of facilities, information and communication technology, programs, and services so that all people, including people with disabilities, can fully and independently use them. Accessibility includes the provision of accommodations and modifications to ensure equal access to employment and participation in activities for people with disabilities. The reduction of elimination of physical and attitudinal barriers to equitable opportunities, a commitment to ensuring that people with disabilities can independently access every outward-facing and internal activity or electronic space, and the pursuit of best practices such as universal design. So we'll have speakers to focus both on Healthy People 2030, as well as diversity, equity, inclusion in our discussion circles. And so today, to give a high-level review of what we have, we'll present on some NEHEP highlights from our partners as well. You'll hear from them. We'll have a moderated chat with a special guest. We'll take a group photo. We'll also have a speed networking activity. And then in the afternoon, after lunch, we'll hear from our speaker at the Office of Disease Prevention and Health Promotion. Then we'll break up into our 2 discussion groups, and we'll come back to the room, have a short report out, have a closing activity, and some closing remarks. And on your name tags inside, you should have received a ticket. And so we have a drawing at the end for a door prize. So, all right. So just quickly to go over some highlights for Healthy Vision Month. Last year we focused on raising awareness about the importance of eye health behavior for families and parents and caregivers of Black and African American and Hispanic Latino children and teens. And so we did some audience research and used the feedback that they gave us to incorporate into our campaign. And in our campaign, we transcreated a lot of content into Spanish, convened a work group, collaborated with a lot of different partners. And we have social media graphics in English and Spanish on the right side of the screen. We also launched 130 pages in Spanish on NEI's website, and we also conducted outreach through social media. And our I Health, My Health campaign, this February for Black History Month, we revamped the Write the Vision and launched our new program. And so it's increasing awareness about eye diseases and conditions among Black and African American people. And so in preparation for our launch, we also convened a work group to do this, and we're looking to pilot with a community-based organization some of the materials to help inform our material development and dissemination. And so NEI's commitment to accessibility, we continue to focus on increasing accessibility on our web content. And in the last year, we made several updates to our web pages to make them more accessible based on usability testing and subject matter feedback. And so we enhanced accessibility for our NEI for Kids webpage, like improving the color contrast and YouTube video embed functionality. So as we shared earlier, we updated the website's infrastructure and plan to continue doing that. And so we prioritize going beyond 508 compliance to ensure all our materials and digital products are accessible to people with visual impairment. And so we will now pass it over to Dr. Julia Rosedal to share updates.
Thank you, Davina, and hello, everyone. I'm Julia Rosedal, and I am a white woman with brown hair, reading glasses, and a red jacket. Last year, NEHEP announced its shift from focusing on low vision to vision rehabilitation. And the goals of the new NEHEP Vision Rehab program are to increase knowledge about vision rehabilitation amongst healthcare providers who see patients with a visual impairment, and to increase awareness about vision rehab among people with a visual impairment to improve their quality of life. As part of that shift, NEI established the Vision Rehab Workgroup to help shape what NEHEP's program and the new resources should include. The primary audiences for NEI's Vision Rehab program have included both people who may benefit from vision rehab and healthcare providers who take care of them. In the last several months, NEI developed and launched 2 new web pages about vision rehab, one for professionals and one for people with visual impairment. And these web pages provide actionable steps for people to take to find vision rehabilitation services and to learn what's available. And NEI will be continuing to work with the Vision Rehabilitation Workgroup to create more resources for professional and consumer audiences. So the work groups we've been mentioning, since 2021, NEI has brought together several work groups to help support NEHEP's campaigns and initiatives, including the iHealth My Health work group, the Vision Rehab work group, and the Healthy Vision Month work group. NEI's work groups convene key stakeholders to help shape and support initiative implementation. The work group members represent a diverse range of professional backgrounds, including ophthalmology, optometry, public health, research, and more. And more than 30 work group members, many in this audience here, have made significant contributions to NEHEP's initiatives by informing goals and audiences, recruiting participants for formative research, making partnership connections, promoting campaign materials, and serving as campaign ambassadors. NEHEP presented how we use work groups to inform priority audiences and iHealth initiatives recently at the American Public Health Association annual meeting in 2022. Now, you all filled out surveys for us. Thank you to everyone who did that. The information that you provided was very informative and useful for helping us to organize our discussion groups later today. And as you may remember in the survey, we asked attendees about their iHealth education goals, challenges in achieving those goals, accessibility in iHealth education, as well as the workplace, and Healthy People 2030. We reviewed each of your responses and wanted to share just some high-level findings, but note that they are qualitative in nature and not generalizable. So first, when asked about what iHealth education goals your organization has for the year, many mentioned having a goal that focused on preventing vision loss through outreach and education. For example, creating resources or raising awareness about specific eye conditions or diseases, educating the public on preventive eye health behaviors and risk factors for eye diseases, consolidating eye health resources on a website, and a few said raising awareness of vision rehabilitation services. Some people also mentioned having a goal that focused on promoting eye health as a public health priority. For example, raising awareness and of supporting eye professions, including optometrists, optometry students, and universities with pre-optometry programs. And some mentioned raising awareness of eye conditions and diseases in specific communities, like older adults, Black African Americans, and Hispanic adults. When asked what challenges your organizations have in reaching your goals, some mentioned logistical challenges like lack of time, funding, staffing, as well as competing priorities. Some said a lack of appropriate health education materials, citing literacy levels, cost, and limited access to free materials as challenges. And a few others mentioned experiencing challenges with the communities that their organizations are educating, like difficulties overcoming existing biases around vision loss and lack of readiness to adopt those eye health behaviors. Most respondents indicated that accessibility in eye health education was in fact already a priority for their organization, over half indicating it as a high priority, and another third as a medium priority. Many respondents indicated that making the workplace accessible was also a priority for their organization, with 59% indicating a high priority and 17% a medium priority. And then lastly, respondents indicated that they were to some degree familiar with the Healthy People 2030, with almost half of respondents saying that they strongly agree that they were familiar, and 20% that they were at least somewhat familiar. So many of our partners have done really great work this year, and we've invited two of them, the Children's Vision Equity Alliance and the International Joint Commission on Allied Health Professional in Ophthalmology, IJCAHPO, because that's a mouthful, to present some of the highlights of how they've collaborated with NEHEP in the last year and the ways that they build NEHEP messaging into their programs. And we hope these presentations will inspire more collaborations with NEHEP as they have for me in the past. So our first speaker is Kira Baldonado, Vice President of Public Health and Policy, who's joining us from Prevent Blindness and CVEA, an organization created to advance equity in children's vision and eye health. Come on up.
Thank you, Julia, and good morning, everybody. It's a pleasure to be here. She said, I'm Kira Baldonado. I am a middle-aged, fair-skinned woman with medium-length brown hair, embracing green on green for my clothing for St. Patrick's Day. I'm here today to talk about a partnership success, both in the formation of the Children's Vision Equity Alliance and what we've been able to achieve with the help of the NEHEP program, as well as blackdoctors.org. So the Children's Vision Equity Alliance was a coalition formed among major medical professional associations, the National Medical Association, the National Optometric Association, APOS, AOA, AAO, AA Optometry, all the A's and all the O's coming together, knowing that we needed to advance equity in children's vision and eye health through education, access to care, policies, and partnerships. The targeted populations for this initiative are the underserved populations, Black, Indigenous, and Latino populations, making sure that they understand the importance of eye health and eye care. With this partnership in place, we reached out to a group called blackdoctors.org, which is an online Facebook-based group that helps to spread information about health and many different topics to the African American population. We posed to them doing one show on the importance of eye health and help people understand different types of eye care providers and what they should be doing to protect their vision. The goal of that one show, and has since evolved, is to provide medically sound eye health information to a primarily Black audience in an easily accessible and culturally appropriate format. So this show has a host that is well known among the population on blackdoctors.org. He hosts many of their different health shows and is really admired by the audience. So when Ellis said, yes, I'll do an eye show, it evolved and was very successful. That one show then got evolved back into a monthly format. They kept inviting us back. So I guess we did something right. So now on a monthly basis, on the fourth Tuesday of every month, log into Facebook Live to blackdoctors.org, and you'll see an eye show there at 7 p.m. That eye show is about an hour in length and is hosted by Ellis, but we also feature African American and Black eye care providers, whether it's an optometrist, ophthalmologist, OT, any profession, a nutritionist that may deal with the topic. We want to highlight those individuals who are of the populations that we're trying to reach so people can see that that kind of profession may also be obtainable for them as well. So it's important to see themselves. So far, we've had 7 shows conducted throughout 2022, reaching 5,000 total views and more at this point in time. And we've been extended through all of 2023. So we see no end in sight for this show. We've had a range of topics covered already: diabetes, gender issues in eye care, children's vision, diabetes, glaucoma, cataract, but we have many more planned to come. So in March this month, the 4th Tuesday at 7 p.m., we'll talk about vision manifestations in sickle cell, a topic that's not commonly discussed and needs to be elevated. Social determinants of health and vision will be covered in April. May will cover pediatric eye safety. June, clinical trials, new treatments, and encouraging these populations to take part in research. July is to be determined, which means I'm open to your suggestions. And August is the Children's Vision Screening Month, highlighting Children's Vision Month as we recognize that as an organization at Prevent Blindness. The way this partnership works, the programs and topics that we cover really align well with the 2030 vision objectives for vision, where we increase the proportion of children aged 3 to 5 years who get a vision screening. That has been a highlight of several of the shows. Understand the impacts of screen time, eye development, and vision loss, and we'll certainly be covering that in pediatric eye safety this coming months. Reduce vision loss from refractive errors, connecting people to eye care, and increase the use of assistive and adaptive devices by people with vision loss as we focus on low vision and vision rehabilitation in one of our shows just last month, which is also accessible on blackdoctors.org. I definitely want to thank those in the room who have been a presenter on the show, so thank you for doing that. And thank you to those in the audience who may have ideas for us, as well as presenters, to be a part of these episodes. Now, the Children's Vision Equity Alliance has two arms, education, so certainly this program, this initiative covers the education arm. We also have a data and research arm of the work, and one of the opportunities that we see to partner for this work is certainly to increase access to vision services in community health centers. We need to see more data, more information, more research being done for vision in those communities so we can see it expanded and we can better address this Healthy People 2030 objective. Thank you for your time. You'll also see Dr. Alexander's listed here. She'll be here this afternoon to answer questions in the small group breakouts about the CVEA. Thank you.
Thank you so much, Kira. That is just so fantastic. Our next speaker is a NEHEP Planning Group Emeritus member, Dr. James Tsai. He's president of IJCAHPO. IJCAHPO offers certification and continuing education opportunities to ophthalmic allied health professionals.
I want to thank Julia, Davina, Maria, and all those who made this summit possible. I'm representing IJCAHPO, and Wade Delk is also here from IJCAHPO. I wanted to tell you about an innovative webinar we had partnered with the National Eye Institute, NEHEP, last year for IJCAHPO technicians. This occurred almost a year ago. Oh, I forgot to mention, I'm an approaching senior-aged Asian American man wearing a light blue open collar shirt. I should have had green, I think, and also a dark blue suit. So as I mentioned last year, we wanted to really reach out to our ophthalmic technicians and assistants and partner with NEHEP. As you know, for our ophthalmic technicians, that's an incredibly key role with patients. Oftentimes they're the first gatekeeper for the patient visit. Patients have a lot of questions, and they are oftentimes the first part of the clinical leadership team that begins to earn trust. We wanted them to know about the wealth of resources available through NEHEP. And what we found exciting was that NEHEP has already curated and these simple one-page patient educational tools, which they call patient eyesights. And we wanted our technicians to know more about that. We felt that these resources would be very dynamic for not only our technicians' education, but also for patients and other members of the clinical care team. IJCAHPO has 31,000 certified technicians with a focus on diversity, equity, inclusion, and accessibility, just like what the president has asked the NIH to focus on. There's a low-cost entry into the field for ophthalmic technicians, and we think that's incredibly valuable because 80% of the programs are on-the-job training, and these are low financial barriers for folks who want to get involved in the healthcare industry. We offer online courses, certification, scholarships for continuing education and students, as well as diverse technician exposure on our websites, careers, and promotions. So if you focus on diversity, equity, inclusion, accessibility, you can see the gender breakdown of ophthalmic technicians, the educational level, and it's about a third have some college, but you can see that 15% have high school or equivalent, 21% associate, 22% bachelor. And look at the age ranges of the respondents. There's a varied mix of ages and also race and ethnicity. So we believe that ophthalmic technicians really are a way to increase access for patients, as well as offer a very nice entry-level position for those interested in helping with eye care. The patient key eye sites are listed there. You can see they have QR codes, which make it very helpful and easy to facilitate education. These are some of the NEI patient resources for ophthalmic technicians that we introduced to our ophthalmic technicians with this webinar. We also did a program evaluation of the 351 attendees who were on the webinar. And you can see some of the comments that were cited. They loved, one person said, loved all the handouts and materials, loved that we can work to educate our patients and their loved ones. And after the webinar, the evaluation was over 90% on the questions we asked the ophthalmic technicians. We then surveyed the same group of technicians 9 months later. And you can see that there were still a lot of really great feelings about the webinar. One participant said, "I did not know that there were programs like this to help Hispanic and Black communities." So really trying to reach the underserved, trying to enhance equity of care. And you can see that at least a majority of them had used the QR codes, the AMD guides, and have used the glaucoma site. So I want to thank you on behalf of IJCAHPO and really welcome continued discourse with all of you. We would love to partner with all the organizations here today and continue our strong partnership with NEHEP. Thank you.